Hi everyone, welcome to my channel. My name is Jyoti and I am a physician with 12 years of experience in the medical field. I created this channel to share my knowledge and expertise with you and to provide informative content on various medical topics. Throughout my career, I have had the opportunity to work with a wide range of patients and medical conditions, and I am passionate about helping others understand the complexities of the human body and the treatment available. Whether you are a student, a healthcare professional, or simply someone interested in learning more about medicine, I am excited to have you here. Thank you for joining me on this learning journey. Let us dive in. So, today we'll be discussing this important diagnostic tool, which is known as Ergonovine Test. This tool is used to evaluate coronary artery diseases. So, if we'll go for the details, Ergonovine Test involves the administration of a medication called ergonovine, which causes the coronary arteries to constrict and allowing doctor to assess the blood flow to the heart. This is for detecting vasospastic angina, which was previously also referred as prinzmetal or variant angina. This test particularly useful for patients who may not be able to undergo traditional stress test. This test is more significant if we get a younger person with atypical angina type chest pain and having a clean coronaries in the angiogram. Now, if we'll go through the methods of doing the test, it has basically three parts. First is preparation. Here we need to obtain informed consent from the patients and explain the procedure, its risk and benefits and any possible side effects. We must know about the medical history including any previous heart conditions, allergies or medications. We must ensure the patient is fasting for at least 6 hours before the test. We must explain the test involves the injection of a medication that may cause chest discomfort or other symptoms. In second, the procedure part, patient will be asked to lie down on an examination table and will be monitored for the heart rhythm. A small intravenous catheter will be inserted in the vein in the patient's arm through which the ergonovine injection will be injected. A baseline ECG will be done and the patient's blood pressure, heart rate and ECG will be monitored for at least 30 minutes. If the person experiences chest discomfort or other symptoms during this test, such as shortness of breath, palpitation, or sweating, they should inform the healthcare provider immediately. After 30 minutes, a repeat ECG will be obtained to evaluate any change in the heart rhythm or blood flow. And number three is once the test is complete, the intravenous catheter will be removed. The patient will be observed for an additional 30 minutes to ensure that there are no delay complications. If the patient experiences any symptoms after the test, they should inform the healthcare provider immediately. So we came to know that the test is basically diagnose vasospastic angina. So here we can give calcium channel blockers and or nitrates as a part of treatment. So finally, here we can conclude that ergonovine test is a important diagnostic tool for evaluating vasospastic angina. It is a safe procedure, but it is important to monitor the patient carefully for any adverse reaction. Now, thank you for watching this medical video today. I hope you found information presented useful and informative. If you have any questions or comments about the information presented today, please feel free to leave them in the comment section. Remember to take care of yourself and prioritize your health. Thank you for watching and we'll see you in the next video.